Hello everyone, my name is James. I'm doing a video today. This is my first video on the subject about the single anastomosis duodeno-ileal bypass. That's a lot of words. Basically, it's a new weight loss surgery procedure, and I just want to tell you some background about myself and about why I chose this procedure, and kind of give you an introduction. And then when we wrap up, I'll tell you what I plan to do as far as in future videos. To get started, I'm 37 years old. I've been overweight my whole life. And I just had a little girl about 15, 16 months ago. And that gives you a different perspective on life. And I found myself not being able to play with her like I wanted to. And when I went to buy some life insurance, the life insurance company said I was basically I was too fat for my height, and my BMI was too high, and they wouldn't sell me any additional life insurance. So as a man, that kind of spurred me to look at some changes, because I don't want to leave my wife and my little girl unprotected or untaken care of as far as their future goes. So I decided to make some changes, and I've tried to lose weight in the past, and I've lost weight and gained it back, and then some, and lost weight and gained it back and then some, and just never really have been successful long term. And so I started doing some research on weight loss surgery, and that's kind of why I chose to pursue that path, is because it does offer a better chance of long-term success. As far as my stats go, I've got a little cheat sheet here. That's why I keep looking down. As far as my stats go, I'm 5'7". My highest weight was 366. When I went to see the surgeon for the initial consultation, I was 361. When I went back to do the surgery scheduling, I was 355, and I'm not sure exactly where I'm at right now, as I've been doing the liver reduction diet, and I'll get into that in just a minute. But I would guess I'm somewhere down about 350. I haven't weighed, so I'm gonna have, today is I don't even know what today is. It's Saturday, October the 25th, and having surgery on Monday the 27th at about 10:30 in the morning. Again, I'm going to have they call it the SADI-S. I'm going to call it SADI-S. I don't know how they pronounce that or whatever, but it's the single anastomosis Duodeno-Ileal Bypass. And basically, it's a sleeve gastrectomy with a malabsorptive component. And the reason I chose that is because it offers a little bit extra in terms of excess weight loss. I need to lose about 210 pounds to be considered in the normal BMI range. And a sleeve gastrectomy would, if averages hold true, I would still be obese, possibly still morbidly obese. So the sleeve gastrectomy alone just really wasn't, it was not going to provide me with what I needed based on averages. Again, I could have been better than average or not done the average. So I wasn't willing to risk that. Then there's the gastric bypass, of course, that offers a little bit better weight loss than the sleeve gastrectomy. Long term, I've known several people with gastric bypass who've had problems, and they've gained a lot of weight back, and I don't want to put myself in that position. So after back and forth and research, I've come to determine that I needed the sleeve gastrectomy with the malabsorptive component. Some people have just the plain traditional duodenal switch. I had thought about that. My surgeon offers this new procedure, which they're collecting a lot of data on now in terms of long-term outcomes. But from all the research I've done, it looks like it's offering pretty close to the same outcome as traditional duodenal switch long term. Again, there's some unknowns there, but I didn't see anything in my research that would turn me off from it. So what I'm going to do is give you a basic explanation of how the procedure is done. Mine will be done laparoscopically, meaning they'll make 4 or 5 incisions. I'm not exactly sure how many in my belly, small incisions. The doctor will go in with instruments. He's going to try and use robotic surgery. My surgeon I didn't mention is Dr. Paul Enochs from Bariatric Specialist in North Carolina, in Cary, North Carolina. And basically he'll do a sleeve gastrectomy, which is he'll remove the largest part of my stomach. And after that he'll come down, and the pylorus is the part of the stomach where the intestines attach. He'll come down below the pylorus, that's a valve there, and he'll cut the intestines free, and he'll bypass a certain amount of the intestine and then reattach them there at the pylorus. In his office, he calls this procedure the SIPSS procedure, which is Stomach Intestine Pylorus Sparing Surgery. And the benefit over doing that versus a traditional gastric bypass is, number one, there's no pouch. There's actually the whole sleeve of the stomach, which leaves your pylorus intact, which the pylorus will regulate the food leaving the stomach and going into the intestines. If you've heard people talk about with gastric bypass dumping syndrome, the pylorus should regulate the food leaving my stomach, so I shouldn't experience dumping. Now, that's not to say it wouldn't happen, but I should not. That's one of the benefits of this procedure. Why this one over the traditional duodenal switch? It's one less anastomosis, which is one less place for a leak to occur, one less place for an ulcer to form. So that was the, and it's less surgical operative time, which means, the longer you're under anesthesia, the longer they have you cut open, the more risk of something going wrong. So the risk was lower than with a traditional duodenal switch, and it gave, at least in my estimation, some advantages over the gastric bypass, the sleeve gastrectomy alone, and definitely over the lap band. As far as the workup that I've been through so far, obviously I've been to my primary care doctor and got his blessing. Had some blood work to determine, if all my vitamin levels and all that were okay. The only thing was a problem was my white blood cells were a little bit high, but nothing to write home about. And I had a follow-up, and they were fine. I did have was positive for H. pylori, which is a bacteria that grows in the gut that could cause ulcers. So Dr. Enochs prescribed some medicine to treat that and get rid of those bacteria. I also had went to the hospital to have a I'm going to call it an upper abdominal workout. I had a what they call a barium swallow, where you swallow some liquid and they watch it on a like an X-ray machine, and they have you turn over left, right, turn over on your stomach, back on your back, and they watch how this liquid moves around in your belly, in your esophagus and all that, and they can tell if you've got a hiatal hernia or got some other problem, reflux, whatever that might cause a problem with the surgery. I was clear on that. I also had a chest x-ray, it was clear. I had a ultrasound of my liver, and I don't know what all they ultrasounded, but everything was fine on that. I believe that's oh, I had an EKG. The EKG was fine. I had to go for that was all done in about 2 hours. All those tests I was just telling you about. It was really quick. It was at the hospital. It was painless. I mean, I wouldn't say I would, look forward to it as something to do every day, but it was painless. It was just a inconvenience having to be there and, deal with hospital. But again, nothing to it. I had to meet with the gastroenterologist to go over my results. That was no big deal. He said everything was fine. I had to go see the psychologist, not a psychiatrist, a psychologist. And basically all that consisted of was I did a test with about 100 and some questions, true, false. And then he talked to me for a few minutes about, my background, how many brothers and sisters, my health history, mental health history, why I want to have weight loss surgery, just basic questions, maybe 20 minutes worth of chit-chat. And then I had to go for a follow-up with him to go over the results of everything. Basically, the test, the true-false test, was just to determine if you're likely to abuse your medication, or if you're how likely you are to follow the doctor's instructions, and your outlook, your general outlook on your health and in life in general, whether you're optimistic or pessimistic. He said everything was fine with me. He said I would do very well. He was a weight loss surgery patient himself, and he had some success. And then he had a lap band, so he was having to have that removed and have a sleeve gastrectomy done, but which is, from what I understand, is pretty common now. But anyway, we had a nice chat, and everything was, like you said, everything was fine. He said I would do very well, wouldn't abuse my medicines. I would do what the doctor said, which I could have told him that, but it was just a hoop to go through. Then after that, I went back to Dr. Enochs and just scheduled the surgery. He had to get it cleared with the insurance company, which is Blue Cross Blue Shield. And I've heard some people online talk about this procedure being it's experimental, so insurance won't cover it, or if your doctor does get them to cover it, it's fraud, blah, 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 blah. That's bull crap. My doctor put in a request for this surgery. I was denied because it's not a routine procedure yet. So he had to do a peer-to-peer review with the medical director at Blue Cross, and it was approved. No problem. No insurance fraud there. It's people that say that are just haters. I don't know. So I'm all set for Monday to have the surgery done. I would lie if I said I wasn't a little bit nervous. I'm not as nervous as I thought I was going to be. To me, the most nervous point was actually scheduling that initial consultation with Dr. Enochs. I was really, really struggling with that. Just nervous. I mean, felt like I could throw up, the whole gamut. But Dr. Enochs made me feel at ease when I went and met with him, and this whole process has been very easy. Dr. Enochs' office has taken care of so much stuff for me that I didn't have to worry about. So everything's been fine. For the past couple weeks, I've been doing a liver reduction diet, even though not sure it was really necessary, because I've lost weight, and I don't eat a lot of carbs. My liver was not enlarged on my ultrasound, but just for the safety of the surgery, I decided to do the liver diet anyway. Dr. Enochs recommended it, but so I decided to take his advice, and basically it's for the first week, it's 2 shakes a day for breakfast and lunch. You can eat snacks like a few nuts, apple, veggies, no carbohydrates, no junk food. Then for dinner, palm-sized piece of protein, a couple handfuls of vegetables. If you need a snack, some nuts or some of the protein bars or crisps. Or anyway, you're just trying to keep your calorie count down and your carbohydrates down. That went very well for the first week. Second week is 5 shakes a day. I've kind of stayed on the first week plan more than going to the second week plan. It worked well for me. I know I lost weight, and which when you lose weight, your liver will shrink up. And now I'm just going to do shakes for the rest of the time. Again, just to prepare myself. But I feel like I'll be in good shape when Monday comes. I just want to tell you what I want to do in the future as far as this YouTube channel. My goal is, obesity is such a problem, and it's plagued me my entire life. It's kept me from doing things. It's caused me physical problems. My feet hurt, my back hurt. I know it's because I'm carrying around 210 pounds of excess weight that I never get to sit down. I never get to take it off and just lay it down and feel what it's like to live normally. So I believe weight loss, fighting obesity, weight loss surgery is important. And on my channel, I want to share my experience. Want to share updates about my progress, how things are going, and hopefully share some information about this new procedure, because there's not a lot of information out there. If you do a research on it, you're not going to find a lot of patient stories on it. You can find tons of vertical sleeve stories, tons of gastric bypass stories, tons of lap band stories, but you just don't find many people sharing their story that have had this single anastomosis procedure. So I want to share my story, my progress. Hopefully it'll help somebody else. One thing I'm not going to do on this channel is I'm not going to come on here. I see some people on YouTube that come on there, they just crying, today's been horrible and I've had a bad day and I wanted to eat everything in sight and I couldn't eat. No, you won't see that here. I'm going to stay positive. I'm going to stay upbeat, because that's my personality. I'm not a person who likes to whine and complain, and I don't like it when others do. If I'm having a bad day, I'm going to suck it up. I'm not going to make a video that day. And then when I'm having a good day, I'm going to make my videos. So just know, I will have bad days. I know that. You should know that. But you won't see those on here. You'll see the good days. If they're bad, I might mention them, but I'm not going to get on here and put on a pity party. So, one thing I did forget to mention is the sleep study I had to have done. I had never had one done. And turns out I have pretty severe sleep apnea. Other than that, I'm very healthy. My blood pressure, cholesterol, all that stuff is fine. But I had bad sleep apnea. And I should have known. I was really irritable all the time, and I would wake up really tired in the morning, and couldn't watch TV at night without falling asleep. So after the sleep study, they determined I had severe sleep apnea, put me on a CPAP. That thing has been the best. If you wake up tired in the morning, think you might have sleep apnea, go get a sleep test and get a CPAP. Man, it's the best. Oh goodness, I've had such good sleep since I got on that thing, and hopefully there's a lot of people who can resolve that with weight loss surgery, losing weight. Hopefully my sleep apnea will resolve over time, and I can ditch the CPAP. I mean, it's not that it's bad. It's just that you got this thing hooked to your nose, and you want to roll over and kiss your wife in the middle of the night. You got to pull that thing off, and it's blowing air everywhere. I would rather not have it, but since it's helping, I'm glad I do. So anyway, I'll let you know about my progress on that also. But if you have any questions up to this point, I'll be glad to answer them. Like I said, I'm still pre-op, just a couple days out from surgery, and I'm hoping for the best. I'm hoping that I really would like to get down around 185, maybe 180, 190, somewhere in there. But anything under 200 pounds, I would consider just a super success. And Dr. Enochs believes I'll get down that small. It's just going to be a matter of time. But I'll keep you updated on my progress. If you got questions, send them in. Email me, whatever. Post them in the comments. I'll try to get back to everybody as quick as I can. Make sure you subscribe to my channel because I'm gonna, if I put out new videos, you'll be alerted that I've put out a new video. I don't plan to do them every day or even every week, maybe. Right here at the beginning, you'll probably see several videos right in a row. You might not see any for a week or two, or maybe a month, and then I'll give you a progress video. So that's kind of what to look forward to. I'm gonna go ahead and wrap up and just say thanks for watching. Thanks for sharing my journey with me. I really hope I can help some other people decide to make the decision that I've made. And just look forward to what's going to happen in my life. I'm a Christian. You'll see some of that in my videos. I'm believing God that He's going to do amazing things in my life and in my future. And again, thanks for watching. Have a great day.